In this presentation, we're going to talk about oral health strategies for the obese patient. Obesity is epidemic. Everybody knows that in America. Obesity is very complex. I want to acknowledge someone at the very beginning here. I want to acknowledge a dentist who is a real thought leader who's changing this conversation. Dr. Susan Maples is the originator of what's called the Learning Lab, and I met her at the conference of the American Academy of Oral Systemic Health. And the Learning Lab is something that we're going to be implementing with the doctors that I'm working with. And what it is, it's starting with children, and we're changing the approach to dentistry with children. And we've created she has created, I haven't, a hands-on learning lab where kids are learning about bacteria and nutrition. She is probably doing more in her practice for obesity, for the approach to obesity, than any dentist that I know. And so you don't think of treating obesity in a dental office, but it's a giant opportunity to have a conversation about diet. And what Susan has done with her very creative group of people that work with her is that they're saying we need to change this approach, because obviously everything we're doing in medicine and dentistry, for the most part, is a failed model. It's a treatment model. It's not a preventive model. And she's got a track record, and I'm very excited about getting involved in some of the work that she's done in prevention. Let's make this an educational model, and let's start with the kids so that they understand diet. Because, like I said, when I get into showing this slides about obesity, this is a tough one. This is very complicated on many fronts. But let's talk about the oral implications of obesity. Obese patients have a rate of periodontal disease that's 75% higher than individuals with a normal weight range. Now, obviously, a lot of this is probably diet, and it's probably acid challenge with soft drinks. There's probably more going on here that are affecting that. That makes total sense. But what you have to understand is that if you have that much more risk of periodontal disease and you're overweight, you are a slam dunk guarantee for diabetes and heart disease. That's a given, okay? You can make that connection without, and then arthritis, cancer, sleep apnea. It is the superfecta of problems, okay? It's everything. So we need to approach this not only for the patients that present with this problem and do a better job of education. See, this is what my whole model is about. It's about that we have failed to educate patients properly as to how to prevent all types of diseases. And dentistry has done a lousy job. The amount of dental disease today hasn't changed in my career. It's the same or worse, okay? So let's change our approach. And Dr. Maples has a fabulous program that she's doing to address obesity, amongst other things. So, and like I said, this one's tough. I find obesity to be one of the more challenging things because it's very complicated on many levels. You have a psychological component, you've got a dietary component, giant medical component, because you've got all kinds of things going on as a result of that. So the protocol here looks very similar to the diabetics and the heart disease or whatever. We can address this component of the oral infection and the periodontal disease, but there's a lot of complexity with the obesity that's got to be addressed with a dietitian. Okay, it has to. And hopefully using some of the components of her learning lab with adults. Let's have the acid conversation. I don't think people really, the dentists don't have the conversation of the acidity challenges that you have on a daily basis. And what happens is when you sip on soft drinks all day and you have this constant acid challenge, it's not only taxing on your pancreas, but it is just an absolute perfect environment for rampant gum disease. Okay, it's just an absolute given. Okay, so maybe if we interject more of that conversation, but we're going to go through the entire bacterial protocol, and very similar to the previous ones. Okay, oral disinfection, but once again, I find this one to be a little bit more challenging, and a little bit more complex because it's got so many moving parts, okay? And once again, we're going to work with whoever we need to work with, whether it's your primary care physician, dietitian, but we want to make sure that the oral component that is contributing to the multitude of syndromes that you're probably going to have, and we want to minimize that risk with all of the protocols here that, like I said, very, very similar to the previous ones for the diabetic patient and for the heart patient or whatever. So that's kind of the whole spin on obesity. There's no question that it increases dramatically the risk of gum disease, and then this starts the whole cascade of a whole bunch of health problems. So we will do our very best to mitigate the oral component of that and try to make some connections with other healthcare professionals and kind of approach this in a joint fashion.